start treatment early.
Yes.
Okay, don't wait until what we call end stage.
Yeah.
Okay,
And it. And yeah.
because by then
The cows are not coming home.
less will health. So the earlier you start treatment, the highest chance will get a good response.
Beautiful.
So other than pill, what else can you do? Okay, so one of the therapy that I get so excited is the shock wave therapy.
This has been the limelight of all communication that I actually happen to face talking to physicians. I've got physicians asking me, like, what is shockwave therapy? Because patients today are more educated walking into a family physician's practice. So, what is shockwave therapy, Dr. Kwok? I mean, there's a few companies out there that say, they have a shockwave therapy device, but let's just point out what shockwave is, and then maybe we can find the Rolls Royce of devices.
Yeah. So shockwave is that I believe they use sound, okay, to make a wave. Okay. Not all shock waves are the same, which is very important to know. So those that's used by usual physiotherapy for muscle pain is very different from the kind of shock wave that designed for expansion. Okay, keep that in mind. There's only a very few company. There's I think about 3 or 4 types of technology that will give you the appropriate shockwave therapy. That's what they call low intensity focused shockwave.
Thank you very much. So, guys, hear this. You do not want to get the wrong shockwave therapy. You want to get focused shockwave therapy, and not because I actually did a chat GPT search on what shockwave was myself, and I found out there was radial shockwave, and there was, not with low intensity. There was, there were all other kinds, but I think to treat erectile dysfunction, ask your family physician today if they carry a focused shock wave therapy system.
Yes. Okay. So many physiotherapy they use what we call the radio shockwave. Okay. So the sound, the wave sound, okay, from the headpiece, okay, that's spread. The applicator they spread radially a fan shape outward. Okay. So this one is really good for muscle pain.
Your musculoskeletal conditions.
So some of them can be quite painful, very smaller in the size. Okay, but these type of devices very little pain to the circulation of the units. That's not ideal. So when you're talking about the uh, focus shock wave, okay, is the wave, the wavelength, okay, from the applicator go in the straight line,
Yes.
okay, or even a focus, okay, just to target the area where the application is on. And what it does is two things, okay, so where they hit the blood vessel, it extend the blood vessel and restrict the blood vessel. Okay, not massage the blood vessel.
I see.
So this type of expansion will stimulate new blood vessel formation. It also increase the blood flow. Okay, so these are the type of device you want.
So, from and little medical knowledge that I possess, obviously, is creating new blood vessels. Would neovascularization be the right term, where I think that sort of triggers angiogenesis? So
Yes, neoangiogenesis.
I mean, that's something
That's an archaeological jargon.
yeah, I mean it's like gibberish, well, but at the end of the day, guys, this is important. You want neovascularization. You want angiogenesis to occur because that creates, as per Dr. Kwok, creates new vessels, and I'm sure it improves the flow in existing vessels.
Yes.
So before and after ultrasounds show us that.
Yes.
Okay, it's fantastic. So Shaw wave therapy, light intensity extracorporeal shock wave, focused shock wave therapy is your number one treatment choice, which can perhaps be layered. And I'm sure Dr. Kwok will talk about this. He's talked about cosmetic procedures offered at clinics actually as well. But going back to shockwave therapy, um, is it painful? Like, how many do they need a lot of sessions? Can for a few dollars, can they get their erections back? Actually, because I'm sorry, it's a loaded question, but it is the question of the hour. Because those watching you today are going to. I mean, it's like a blessing in disguise that there's somebody talking about this, and we want to make sure that we get the right information to you at the right time. So, Dr. Kwok, what would you say to this?
So there have been several models on the market, okay, and I believe the earlier model, okay, some of the early model because of the sharp focus, okay, it can give you a bit of pain, okay. So the newer model is different. Everything is great. The world is moving forward. Okay?
Yes, the world's
So
going
you
forward.
don't stay
Yes.
behind, okay? Is that you can achieve the same effect with what we call low intensity, okay? So low intensity doesn't mean that it's less effective. It's very effective, but it doesn't give you the pain.
Right.
Okay, so there's no downtime. You feel very comfortable. Okay, you come in maybe during your lunch break. Okay, have the session and then go back to work and continue your life as if nothing has happened.
Do they need a gazillion sessions?
No, usually on average, okay, 6 sessions, 2 sessions per week.
Amazing. A 3 week course, and you're on your route to getting erections.
Yes.
Morning erections, bedtime erections. I mean, it's all about blood flow. And I think angiogenesis and neovascularization are your next Google keywords because you want to raise your hand and say, I've got this. Okay.
So according to one study, okay, where you have the right type of person, okay, yes, uh, the efficacy rate can be up to 90%. Okay.
Guys, you're gonna have him repeat this. Hang on 1 second. I mean, this one can stay for the record, actually.
I didn't do the study, okay? I didn't do studying, okay? According to some study, okay? Now, a lot of times when men have the problem, they have other causes as well.
Sure.
Okay? No, it's not just cholesterol creation. They may have a hormone deficiency. They may have some psychoactive factors. They may
And we talked about all that.
that.
Yeah.
So often, in the real world situation,
Yeah.
I'm not talking about one cause.
Right.
Usually, it's a combination of cause. But and therefore, often, okay, is that you use combination therapy. Okay, well, that's a shock with.
That's what I said, and Doctor said it as well. It's a synergistic combination of amalgamated technologies put together that can be layered, but you gotta know where to start. And when you do a quick lunchtime 15-minute treatment, I would say, that is done with shocks. Actually, I think, and you want to make sure that you pick the most modern device. I think you want to, well, let's talk. Actually, in fact, what I want to do is I have this little study here that I pulled out. It's right over here. And, this study actually clearly and before I came on the show, I looked at various devices that you brought up are out in the market, and this clearly states some of the winners out there, some of and these and what caught my attention, and this is of course I think for the end users, who are going to be patients to their own family physicians, is that you want to have a device that has a patented multi-wave technology. instead of a singular wave, a multi-wave sort of ripple technology, basically. You want to, and of course, I think Dr. Kwok did mention there's, you know, before it was a little painful, and some of these devices can be painful. But if you have something that has a larger spot size, you know, you have a higher chance of efficacy. I'm just reading on some of, you know, what AI has pulled off, and of course, everybody relies on the AI these days. And at the same time, you know, you want to have a device. Actually, I'll bring it up because it mentions the spec E device, which also states has the most amount of research done with clinical trials and studies and papers published, actually, that has one of the largest throws or focused shock waves. So that means that if you're actually treating something, their focal area is 130 millimeter. Um, and there's other devices um, out there, but I just did a comparable, and that's what kind of popped out as a clear differentiator between, um, I would say, the winner and the one. But I'm sure they're all good because at the end of the day, doctors care about results. But I asked, you know, Claude a simple question: what was the Rolls Royce of shockwave devices that focus shockwave devices that treat ED? And the Omnis ED, hands down, was a clear winner in every single division. What device do you have?
So I'm only stack.
Okay, so I think so we go at a crossroads. We actually met at the same point. Okay, what made you choose that device?
Uh, it's very easy to use. Okay, from my phone, okay, is effective. Okay, so that's the two things I pick.
Okay, excellent. So, I mean, not that, you know, we're promoting one or the other, but I think, you know, it's important that when you go to your family physician and you talk about ED with them, you also want to know this, like, in aesthetics, you know, they ask you, okay, well, which filler brand are you guessing, or which Botox, which
Now, and then you're expecting in like patient comfort and the time amount and involved to finish one procedure. Okay, I think so. You have a winner there.
you have a winner. So comfort and efficacy is not everything. It's the only thing, I think, right? So I think, you know, uh, and there's always innovation. Tomorrow we'll have something new or something more enhanced, and it's our job to talk about this to at the end users, the end customers, or even to physicians that are actually. I mean, I even asked that, you know, about market share to different AI, to Gemini actually, and they said, you know, it dominates the market share all over the world. So certainly, hands down, I think one of the, you know, the Rolls Royce or the Bentleys of all devices happens to be the Omnis device, and Dr. Kwok has that device. Uh, Dr. Kwok, you've treated so many patients and you've had such a high success. Let's talk about uh, you know, patient selection. And I think that's probably an important aspect.
So the final thing is that you need to determine that one of the primary cause for the ED is circulation and the fuel supply. Okay, that's very important.
Yeah. Yeah. Okay. So, you know, I think patient selection with Dr. Kwok, and for all those practitioners that follow him and are watching him, because obviously he's a professor. You know, he is part of a couple of institutes where he also trains and teaches other physicians on the exclusive techniques that he's in, sort of, you know, learned and enhanced, and maybe in some cases innovated as well, which I was fascinated to hear. We'll leave that for another day. We'll do another podcast on that actually. But as far as blood flow goes, we've actually opened up the flow through light intensity, extrapolable shock waves, uh, and of course created the neovascularization slash angiogenesis, which triggers that. So, and with the shock wave, should they then opt in for um, PRP treatments? I mean, that is a question that.
Yes, so this is one thing that I'm looking into it right now because it makes a lot of sense. Okay, because shockwave does use some trauma.
Yes.
You know, it doesn't really hurt you probably, but that's how you get that new blood vessel formation. Okay, and PLP, okay, is that yes, fairly rich in growth factor.
Yes.
Okay, so when you apply PLP after shockwave therapy, okay, it should work better. Okay, so that's what we call combination therapy.
Surprisingly, you mentioned this, and I remember reading earlier. I don't want to pull out the same paper, but I think there was some study out there where this omni, and please put it on the screen if you possibly can, where there was a study that actually sort of combines PRP and has terrific, and this fantastic results that I was sort of mind boggled by. So, is it safe, in your opinion?
Oh, it's absolutely safe.
Because we're going from something that is totally non-surgical to something that has needles involved. And
PLP has been used by the medical community, okay, and by other cosmetic for decades. Okay, so initially how PLP developed is that they use for burn patient. So you have full single skin burn, yeah, and when you apply PRP, it really can work. Okay. Yes, we know this benefit for about how many decades I don't know. Because I couldn't really keep track of that, but somehow it never get into the mainstream medical community for a lot of reasons. Okay, but it works. Okay, so people have used it for a long time. As far as I know, that's only one case. One one has case of complication. Okay, so someone actually makes it with Lidocaine, injects somewhere that's not appropriate into the blood vessel, and it can form a cough. I don't know what kind of substance